Hi, and welcome to Chapter 18. This is where we will talk about preparation and examination of the GI tract. Throughout this chapter, I'm going to briefly explain what you're looking at in some of these studies and some of the contrast media that we use during these exams. This is something that you'll continue on with in positioning class next semester for winter semester with Cindy, and you will be taking a look at the positions and what you're actually looking at on the radiographs. So this is more of an informational session on what it is and kind of what you're looking at, and you'll get into a lot more detail as you progress. So there are some key terms that we'll talk about. I don't expect you to know everything in this chapter, but just some of the highlights in this chapter so that you're at least able to look at an image and go, oh, that's a BE, right? So when we're taking a look through this chapter, one of the things that I want to point out to you is that there is a guide to sequencing orders for diagnostic studies. If you were to do a abdomen radiograph, if it's already full of contrast media, you're not going to be able to see what you should be seeing for the anatomy. So one of the things to take into consideration is if you need to do any exams that do not require contrast media and any laboratory studies for iodine uptake, then you really should take those images first and then start the sequence of exams. So anything that requires the urinary tract would be next, then the biliary system would be next. Lower GI should be done before upper GIs, because when you do an upper GI, that contrast media is going to continue to flow into the small intestine, down to the large intestine, and it'll interfere with that study. So do the lower, then the upper. Same thing when you're doing any CT studies that require contrast. They need to be done anytime blood has been drawn for iodine uptake studies, and then your CTs of the abdomen or pelvis should include examinations involving your barium. So when you're scheduling multiple studies involving administration of that iodine contrast, you want to make sure that that isn't going to totally exceed the maximum dosage of that iodine compound that's required for that study. So kind of think about that when you're doing an exam. You know, especially your patients that are elderly, they should take priority over someone who's young and healthy. So when you're looking at your exam list of who you're going to grab and take back to the room, you want to take that into consideration as well. So really know your exams, what you're looking at on your exams, and then make a well-informed decision on how should you sequence those exams. So if you see something's been ordered in the wrong order or scheduled in the wrong order, you may have to go in and reschedule, have someone reschedule those exams so that they are in an order that makes sense. So when we have inpatients, that's pretty easy to do, because then we just kind of revamp what those orders out. Our outpatients would have to be contacted, so it's something that hopefully somebody caught before they get to the hospital. Your scout radiographs are something that you need to do on every patient to make sure that they have been properly cleaned out and that there isn't any contrast media that's going to interfere with that study. So when you bring your patients back, you should make sure that you've asked, have you had any prior exams? If they say yes, you need to continue that conversation and find out what they've had done. Sometimes your inpatients, they're not going to know, and the nurse that's on duty might not know. So that's a way to take a look at the chart, find out what they've been ordered, and then determine, can we continue on with the study. Your scout radiographs, so let's say you have somebody that just doesn't know. They're an outpatient, they've come in, they don't know what exams they've had done, because that happens. And you do the scout and you see that, okay, this person didn't follow the prep for the exam. They have a lot of stool. We're not going to be able to see what we need to see on this lower GI. So then you'll need to reschedule that exam after they've had a cleansing. Inpatients, again, they're a little easier because you can send them back up to the unit. They can do the enema to clear them out, and then they can bring them back down to the department. But these outpatients, it becomes a little bit more of a concern and a hassle for them. So your scout radiographs, when you take an abdomen for a scout, we're looking to see, have they done the prep work before they come for that exam. Look at how this radiograph is completely full of stool. You can see the entire outline. So if they're coming in for a lower GI or a barium enema, we would not be able to obtain that study on them until they've been cleansed. So this is one where we probably would have to reschedule and tell them they need to follow the proper steps in cleansing out their abdomen with the enema that should have been explained to them by their doctor's office. Here's one. You notice how you can't see the bowel. So if they've done their prep correctly, we're going to be able to see that abdomen nice and clear without any obstructions. Same with our upper GI. With the upper GI, we usually ask them to stay NPO. We do have them swallow their contrast media, so they're drinking that contrast media. It's filling up their stomach, and then sometimes we continue on with that study for a upper GI with a small bowel follow-through. So here you'll see that contrast media moving down and starting to fill past the duodenal bulb here and fill into that small intestine. So typically preparation for the exam means that they're going to be NPO, so nothing after midnight typically. They may have a laxative that they're required to do along with a suppository and a cleansing enema. So if it's an outpatient, they're going to do this on their own at home. An inpatient, they'll be done up on the nursing station, so whatever floor they're on, they're going to take care of that. When we're taking a look at the type of exams that we do, typically we'll have a barium sulfate powder form that we're going to have to mix with water. Some of them come with bags that are already concentrated and ready to use, so then it's just a matter of shaking the bag up. So your department will depend on what they have. Most of them have switched over to already pre-mixed volumes, and then you just pour it into the bag. Some of them will already have bags that are already filled with the contrast media. So your barium enema bags are going to be disposable kits. They're going to have tubing, the plastic bag's going to have markings, there's going to be a rectal catheter, it's going to have a liquid form already in. If it doesn't, it'll have the powder and it'll have instructions of how much water is to be added, and then you do need to shake those up pretty well to make sure that they're mixed. You have water-soluble ionated solutions, so like gastrografin, and these are typically done if the person can't have the barium. So you'll get into more detail in Cindy's class as to what is to be used when it's going to be used. So if the barium is contraindicated, they've had abdominal surgery, they have a perforation that might be suspected, they're high-risk barium impaction, so their stool's going to build up, or neonatal patients, that's where we'll pull out that gastrografin. Sometimes we have a paste form that we use for swallow studies. Typically, these will be pretty thick because they have to swallow it. So just depends on what your patient's having done. So if they're coming in and they're checking, so sometimes you'll have patients coming into the department where they're checking for the reflex. They're going to have that paste that they're going to swallow. Some of the problems can cause dehydrations. There could be aspirations. So that esophageal study where they're looking at the esophagus, there could be complications caused by using that. So we need to take all of that into consideration when we're deciding what type of contrast media to use. If it has an air contrast is a negative agent that's going to increase the visibility of those structures. So it makes it easier to see certain structures that we normally wouldn't see with just the barium. So you will have exams that are ordered as a double contrast study. This is going to be a positive agent, which iodine or barium has been introduced along with air that's going to be introduced into your study. Glucogen is something that you need to be aware of with your diabetic patients. So it's used to treat hypoglycemia. And with the glucogen, again, there's going to be an administration route that needs to be followed if that has to be administered to your patient. Upper GI studies, these are done under fluoroscopy, and you are going to obtain your scalp radiograph, you're going to take your patient history, you are going to give that patient the barium cup, and then they'll be instructed when to drink that cup. So your radiologist will run the fluoroscopy unit, and then you're just basically on standby to assist the patient and if the radiologist needs something from you. Your images are going to look something like this. So this is your stomach filled with barium. And then if we have a double contrast upper GI, they're going to give them some crystals, and those produce gas, and then that gas will help to align that mucosal lining in the stomach. So one thing that you do need to tell your patients is not to burp or belch so that that gas stays in the stomach. So this is what that double contrast exam looks like. So here's the barium, but look at how nicely now we can see those structures inside the stomach with the gas. Small bowel studies can take a while. They could take up to an hour. They could take 24 hours. I had a patient who came in for a small bowel. I left, went home, came back, and I had to finish up that study the next day because it hadn't passed to the point that it needed to. So this is pretty common. The patient will drink the barium. They're going to follow it down, and then they're going to start doing images between 15 to 30-minute intervals. And then the exam's complete when that barium reaches the ileocecal valve. So your small bowels are going to look something like this. So here's the stomach through the duodenal bulb. We're going all the way through the small intestine, and then once it reaches that ileocecal valve, the study stops. And again, it just depends on the patient as to how long that'll take. Intrasilus, this is an injection of nutrient into the small bowel, and this is what this study is going to look like. Lower GI, which is also called your barium enema. We're going to do fluoroscopy. Again, we're going to make sure that we do a scout to make sure that they're properly cleaned out. We'll do this under fluoroscopy with the radiologist. Sometimes there are post films that we will do, so they'll take films with the fluoroscopy unit, and then we'll do some post films, and then we'll usually have them go to the bathroom to get rid of the barium before we send them on their way. So post evac films could be obtained as well. So here's what those scout images look like with a good prep. Here's what it looks like with a bad prep. So this one would be good to go. This one we would have to wait for them to prep. And this is what your barium enema is going to look like. So look at how nicely we can see that large intestine all the way through. If you are in a facility that doesn't have a radiology nurse, you will do the enema insertion. Some of you will have a nurse that will do the insertion. It depends on where you're at. When I worked at U of M, we had a nurse. She came in, she took care of all of that. Every other place that I've worked, it was our responsibility to insert the enema. So the radiographer is usually responsible for insertion of that enema tip, is what I'm trying to tell you, is that generally falls on us. And then your radiologist will come in, they'll inflate the cuff of retention tips under fluoroscopy. You're going to place that patient into a Sims position when you do that, and you must remember to wear gloves and lubricate that tip when you're inserting that into their anus. Your tip is going to be inserted probably about 2 to 4 inches on most people. So you need to make sure on female patients that you're insuring into the correct location. If you're getting resistance, don't force that tube in. So here's an example of what that tube looks like when it's inserted correctly into your patient. So some considerations. We do have some enlarged colons. There is that potential to perforate the colon. Sometimes they'll come in with an ostomy bag that we will insert into the ostomy bag. That'll be the radiologist that takes care of it in that situation. We do double contrast BE, so there's air and barium instilled into that contrast column, into the colon. So you'll typically insert the barium like you would. The radiologist will allow it to flow into the barium, and then there's a ball that they squeeze to insert the air into that area. So again, that's going to provide better visualization of that mucosal lining. So this is what that double contrast image looks like when you have air. Dephograms aren't done very often, but this is a procedure that you do watch the patient attempting to have a bowel movement. So they will sit on the fluoroscopy table in a commode-like device, and we actually watch them try to go to the bathroom. So this is pretty high-density barium paste that's instilled into this. There's usually a video that's being recorded under fluoroscopy. Typically, again, we just kind of stand by. We don't do much of anything during that exam. So no matter what, if a person's had that barium, you want to make sure that they really increase their fluid intake so that they don't risk that building up into their bowels, and then it hardens, and then they have more problems. So you really got to tell them you got to drink fluids to get this out of your system. So the inpatients, again, those aren't bad because the nursing staff will take care of that. But outpatients, you really got to stress the importance of drinking fluids after that exam. So I do have some videos for you to watch on those procedures, so hopefully you'll get a better idea of what they entail. All right, thanks and have a great rest of your week.